Hello, my name is Yehuda Galili, and I'm a third-year medical student at Ross University School of Medicine. Today we're going to talk a little bit about the cell cycle, specifically the G1 to S phase checkpoint, because it's arguably one of the most important parts of the cell cycle. It is highly regulated, highly associated with different malignancies, and of course, highly tested on step 1. I hope you enjoy. So here we have a schematic of the cellular cycle, and I wanted to talk a little bit about the different types of cells that reside in the different parts of the cell cycle, so we have a better understanding of the whole cycle itself. So we have those permanent cells. It's important to know that the permanent cells can never replicate. They stay in the G0 phase and they can never enter the cell cycle, therefore they can never replicate. Those types of cells include cardiac myocytes, striated muscle cells, as well as neurons and red blood cells. If injury were to occur to these cells, the body would have to create a scar via fibrosis rather than normal cellular proliferation. That's simply because, again, they can never enter the cell cycle. Other types of cells include the stable cells. They can enter the cell cycle with the assistance of different types of growth factors. Those include the hepatocytes from the smooth endoplasmic reticulum, as well as the lymphocytes. And then we have the Leber cells. The Leber cells never enter the G0 phase. They constantly divide, and they could be thought of like the opposite of the permanent cells. They always replicate. They include bone marrow cells, as well as gut epithelium, skin, and hair follicles. So a prime example of that would be a cancer patient who's receiving anti-neoplastic medications and all of a sudden develops nausea and vomiting. So that's due to the gut epithelium being sloughed off because of the anti-neoplastic drugs acting at different parts of the cell cycle, as well as baldness. That's also due to damage from the anti-neoplastic drugs at the hair follicles. Those types of cells always replicate just like cancer cells. So as I said earlier, the G1 to S phase is by far the most important part of the cell cycle and is highly regulated. And why is that? Well, in the G1 phase, along with the production of RNA and different types of protein, we also have enzymatic repair of the DNA. So any type of mutations occurring during this phase would be corrected in the G1 phase. If not, this is very important that you guys understand. If a mutation was not caught and went into the S phase and duplicated, we run the risk for cancer. Mutations that replicate over and over again increase the chances of cancer. That's why we have two very important tumor suppressor genes that regulate this checkpoint, these being P53 and RB. So during the G1 phase, we have the production of different proteins, including cyclin D. Cyclin D is a protein that binds to CDK4, which is cyclin-dependent kinase 4. Cyclin-dependent kinase 4 is always inactive. Always inactive unless binds with cyclin D. When this complex of cyclin D-dependent kinase 4, it does what any kinase would do in the human body, and that's phosphorylating. So this complex phosphorylates RB1. RB1, when gets phosphorylated, it becomes inactive. This inactivation of RB results in this phosphorylation of RB results in deactivation. Therefore, E2F, which is a transcription factor, is free to do what transcription factors do, and that's proliferate cells. And the last resort that we have is the P53, another tumor suppressor gene. As we said, P53 is a tumor suppressor gene. And what do tumor suppressor genes do? They suppress. What do they suppress? Proliferation of cells. So P53, just like RB, would also act as a proliferation stopper, if you will. And actually, it inactivates CDK4, also resulting in blockage from G1 phase into the S phase, resulting in less proliferation. P53 is by far the number one most important gene for human cancer. And it's very important that we remember that. Alright, before we jump into this question, I have one more question I wanted to ask you that I thought was very important. Do you guys remember a virus that could result in an inactivation of both P53 and RB tumor suppressor genes? a virus that inactivates two of the most important tumor suppressor genes in the human body? Well, I'll give you a hint. It is highly associated with cervical carcinoma. Well, you got it. It's a human papillomavirus, producing gene products E6, which inactivates P53, and E7, which inactivates RB. So for this question, we have a 13-year-old boy with a history of bilateral blindness presenting to the ER with knee pain. Well, we have a kid that has probably retinoblastoma. Retinoblastoma is an autosomal dominant disease predisposing to retinal damage, resulting in blindness. It also is highly associated with the increased risk for osteosarcoma, is a highly malignant carcinoma of the bone in children between the ages of 10 to 20. For the treatment, I doubt they're going to ask, but it requires surgery and chemotherapy. This Codman's triangle is because the tumor separates between the bone and the periosteum, lifting the periosteum up, creating that triangle appearance. And important to know about this type of cancer is that both tumor suppressor genes on both alleles must be mutated or deleted before the cancer presents. That's called the two-hit hypothesis. It's not enough to have one. You need to have both on both alleles to have the mutation in order to have the cancer. It's also associated with other soft tissue tumors. All right, guys, thank you so much for listening. Good luck, and I'll see you next time.